Hello everyone. I'm recording this a little after the 11th hour of the 11th day of the 11th month, which is Remembrance Day. And I just want to take this opportunity to give thanks for all of those who've given their lives in the service of others through the armed forces, protecting the public. As of yesterday, 8 a.m., Wednesday, the 10th of November, we've had an additional 320 community cases and 5 cases of people positive as they were leaving quarantine. They obviously now remain in isolation. That's a large number of new community cases, but I wanted to try and shift where we're focusing our concerns, because as some will have been discussing, this really is more in terms of how our healthcare services are being used. The large majority of people who are positive are having either no symptoms at all or are having mild symptoms and managing well at home. And I thank you for that. Many people with COVID will have very mild symptoms, maybe a fever, maybe a cough, and will be able to take simple paracetamol, and after a few days, just like with many viral illnesses, will feel quite well again. We were able to undertake what we call a tabletop exercise on this Monday, where we had all of the 3 hospitals, senior members of the staff from those 3 hospitals in a Zoom call together, along with Hazard Management Cayman Islands, members from the Deputy Governor's Office, and also members from the Cabinet Office, to undertake an exercise where we planned and discussed how we would manage 40 patients coming with COVID, then 100 patients, then 200 patients, in sort of a stress test scenario to see exactly what we would do, what steps would be taken in a lot of detail. All of the hospitals already had plans, but we really wanted to see how these plans would work together as a whole, as part of our planning for the reopening process. What we discovered was that the number of beds that would be given over to COVID and still allow routine operations to go ahead would be 55. That means that the elective surgeries would continue, the clinics would continue, and across all of the 3 hospitals, 55 COVID patients could be looked after. So when you think about the 15 admissions that we currently have at the Georgetown Hospital, because there are none in the Doctors Hospital and none in Health City, you can see that we're only actually consuming 27% of the available capacity that the hospitals have put aside to look after COVID-19 patients. That leaves us in a good position. Clearly, we are reopening, and also clearly we are managing the numbers that we have, and we've been in this scenario with positive community cases for some 9 weeks now. And you'll be aware that in many countries around the world, these so-called waves of infection, as they travel through the community and a lot of people get infected, often take around 2 to 3 months to begin to see them burning out. Ours may be burning out a little bit slower because we put in measures particularly to dampen down the infection, so masks, distancing, hand hygiene, our very high vaccination rates, and also the lateral flow tests being used and the policy being rolled out. All of these things will dampen down the spread of SARS-CoV-2, and that's exactly what we want to do, to make sure that the hospitals do not have too many patients at once. Just to give you a little bit more details on those admissions, it's obviously of concern that 3 of those people are in the critical care unit. 1 is requiring a ventilator, and 2 are requiring what we call non-invasive ventilation. That means they're needing some extra respiratory support more than oxygen. It's like having a little bit of, it's like having what we call pressure support, a mask over your face, and then a machine gives you a push when you begin to breathe in, and it helps you to breathe a little bit better, but it doesn't involve the endotracheal tube that goes down the windpipe. So there are 3 people that are needing that extra level of ventilation support, and there are 12 others who are on the general wards. Of the total 15 people, 12 of those are unvaccinated. From Tuesday to Wednesday, 4 people were admitted and 4 people were discharged. And then from Wednesday to Thursday, 5 people were admitted and 4 people were discharged. So even though you hear the number of people that are actually admitted to hospital, this number is moving and changing at all times. The actual people are changing from day to day, which is, again, is good news because people are getting better, they're being well treated, and they're going home. One last message I wanted to give. As we're coming up to the holiday weekend, I'm really excited to be having an extra break. I know we all are, but I will be keeping my entertainments to the outside where I know it's safer. If you're going to mix with people, please do so outdoors. If you can hold off having big parties and big gatherings, especially in indoor spaces, please do so, because that's the wise and sensible thing to do when we have such widespread community transmission. And in particular, be careful of those who are unvaccinated, for example, children, and for those who are elderly or vulnerable. Those people need particular attention with regards to scrupulous hygiene and mask wearing if appropriate. And also for the unvaccinated, do consider getting vaccinated. You'll be aware that there's a slight pause in the vaccination program. Our next delivery is due tomorrow on the British Airways flight, and the vaccination program will be beginning again next week. Thank you, and have a pleasant holiday weekend.
Good night, everyone. I'm your host, Kevin Watley. You're watching the CMR COVID Spotlight. Welcome. And tonight's topic is going to be media coverage on COVID-19. But right before we get into it, we do have a video we want to play from Honorable Premier Panton.
Good day, Cayman. I just wanted to send you a quick hello from my quarantine headquarters. Kind of lost track now, but I think I may be on day 7 now. So nearing the end. Probably feels like day 70, if I'm being honest about it. You know what's interesting about this is it gives me a clear understanding of how people feel having to go through extended isolation periods, particularly when you're not feeling well or you have family members that are not feeling well. I can just imagine how that is. I'm feeling perfectly fine myself, so I'm confident that when I do my test, that I will be clear. I think the chances of me being infected and asymptomatic are probably next to none. So fingers crossed. I don't want to put my mouth on it, as we say, but I'm sure I'll get there. But as I said, it gives me a much clearer understanding of what people go through, and this is one of the reasons why. When I have been given details of people who are in isolation and who are having difficulties and perhaps may not have received the kind of calls that they would like to have, not having had their expectations met in that respect, I like to be able to telephone them myself, to talk them through, give them encouragement, and that's I want to do the same for Cayman right now. We are obviously going through a period of significant community transmission, but the answer to that is, for us, we know what the answer is. The answer is that we need to adhere to the safety protocols, the public health protocols, wearing masks, social distancing, sanitizing our hands. It's not hard, folks. We can do it, and we must do it together. This is not just for our own individual health, but it is for the collective health of the country. We do have despite our level of community transmission, we do have a relatively low number of people in hospital, but we have people who aren't feeling well at all, and I want to extend well wishes and speedy wishes for a speedy recovery to all of those folks who, both at home and in hospital, who aren't feeling very well today. We've got a wet, rainy day. For me, rain or shine, being home in Cayman is just the best place in the world to be, and I hope that everybody stays safe. Let's try to continue to work together to maintain our collective public health. Let's all pray for those who aren't feeling well, and those who are in hospital, that they can recover quickly and get home to their loved ones. I wanted to show you as well. I got my quarantine geo-tracking band on. No special privileges for me. That's exactly the way I like it. The law applies to everybody equally. So, Cayman, have a wonderful day. Please stay safe, be careful on the roads. Let's look after each other, let's care about each other. And our collective efforts will lead to our collective benefits for the whole country. So thank you all. Have a great day. Love you all. Take care.
Well, that was Honorable Premier Penton explaining a little bit about his experience in quarantine. And so we are going to go ahead and get started. But right before we do, just want to let you all know or ask you all to do me a favor. Please share this on your Facebook page or your YouTube. If you are watching, please let your friends know that we are live. The discussion tonight is media coverage and COVID-19. I did reach out to all of the media groups in the Cayman Islands and asked them to join us. We did have a couple respond saying absolutely they'll join. And joining us tonight, Wendy Ledger from Cayman News Service. Welcome, Wendy. How are you doing tonight? You're muted, Wendy.
Yeah, the technicalities of video. What can you do? It's great to be here, Kevin. Thanks very much for inviting me.
No problem. We also have John Fleming. He's from Real Cayman News. Welcome, John.
Thank you so much, Kevin. Great to be here.
Wonderful. And then I know April come in. She said she's going to try to join us a little later on if she's able to. She's still finishing up some of her work duties, but hopefully she's going to be able to join us later on for the discussion. And again, I did reach out to everyone. Not everyone agreed to come on, but either way, we still want to at least have this discussion to let everyone know some of the challenges it really takes to be able to report accurate information. You know, there's so much noise out there, and there's a whole lot of things that are a lot of moving parts, and we want to make sure that people are kind of aware of it from a media perspective. So, Wendy, let's start with you and talk about some of the competition we have in the media to deal with disinformation that's out there and be able to do our jobs.
Sorry, Kevin, when you say competition to deal with misinformation, I'm not quite sure what you're getting at there. Like, help me out a little.
Well, you know, there's a lot of information that's out there. People don't just now get news from Cayman News Service, from Cayman Mall Road, from Cayman Real News. There's Real News Cayman, sorry. So there's a lot of other things out there that, if you want to call it media or whatever it is, they're getting information from all sorts of sources. So, our jobs as journalists is to try to get factual information out there to individuals. So,
yeah, okay, I'm with you. Mm-hmm. Yeah, we're working in a changing environment, and we've all known for quite some time that social media was a game changer when it came to media. It's made things very, very different. But I think here in Cayman, the situation isn't quite as competitive as it used to be. To a certain extent, we're dealing with perhaps more social media now than we are with genuine media. Well, when I say genuine media, that's the wrong word, because it's all genuine. It's just, it's different. We don't have TV anymore, as you know. We don't have so much radio news anymore. We only have the Compass that's really, well, in fact, even the Compass, I understand now, only prints once a week. So we barely have any print media. I think, social media is taking over everywhere, and it's the same in the Cayman Islands, and that makes it very difficult, because who checks who on social media, and we know it's the instant desire to post immediately. You get wind of something, and that's not journalism. That's blogging, social media, or whatever. Journalism is fact checking. Journalism is going and finding stuff out.
Absolutely. And I'm just going to go ahead and add April to the conversation. She did join. So welcome, April. But right before we get to you, I believe you might have some background noise, because when I added you to the screen, I'm hearing some noise. But John, to the question, you're a young man, and of course you're a lot younger
Yeah.
than all of us. What about your thoughts on the question?
Oh, sorry, Kevin. I'm just having some feedback issues. Oh, we're all. Hang on, I can hear you now.
Perfect. Yeah, to the question that Wendy was addressing, you want to kind of share your thoughts on it?
Well, yeah, well, social media has been a game changer in the media landscape here. There's meme pages that pop up all the time in Cayman. There's loads of pages, and they post whatever they need to be posted. But I think that the competition in Cayman isn't as fierce maybe in the US. I know, or just in like the whole media landscape in the world, we're all here today gathered. We're all from different outlets, but we're all here gathered to discuss the issues in COVID-19. So I think there is some, like there is sort of like a bond, if you would, because we're a small jurisdiction, we all have to report on the same stories. So yeah, that's what I would say on that.
And April, welcome to the discussion. I know you really don't need to be introduced because everyone knows you in the Cayman Islands. If they don't, I'm not sure where they're living.
That's not always a good thing, Kevin. Not always a good thing.
So, but yes, no, COVID-19 really has posed a real significant challenge to try to get news and information out there. And there's a lot of different things out there. You go on to social media, you go on to different websites to try to figure out what someone is saying. April, I'll go ahead and ask you, how do you sort through facts versus crap?
Ooh, that's a good question, isn't it? And sometimes it is hard to do. I find it particularly difficult with there being so much information on the internet in general, right? So, and I came in late. Sorry, I was still working. But what Wendy said about fact checking is one of the most critical components of that. So just because someone has said something doesn't make it true. And by the way, that's even people who I trust. Just because they say something doesn't make it so. And so there is that process of, calling other sources, digging up the actual documents that allegations are based on. Sometimes it is as simple as the definition of something that's being used. I'm embarrassed to say, but sometimes I've got to go back to Google and look again and go to a source that I actually know historically provides accurate information. So, I mean, it is a lot of work sometimes to get to the bottom of whether something is true or not. And I think that's probably the biggest challenge, is that actually takes time. I mean, it does take experience too. And this is not a poke at you, young man at all. It just, sometimes you develop over time an instinct that what you're being told or what you're reading isn't quite right. There's just something off about it. And that may be based on prior stories you've covered or, conversations you've had. So you sometimes just get an instinct that I know they're saying this, but something doesn't sound right, and you have to take the time to check that out. And I think that's actually the disadvantage for journalism proper, is that it takes a lot of time sometimes to get to the bottom of one tiny component of a story, let alone all the other things that are coming, out all day long and all night long now with the internet being what it is.
So why should people trust the Cayman Islands news organizations that are out there? Wendy, I'll have you start that off. Because really, why should they trust what you write or what Sandy writes?
Yeah.
So
it's a really good point. And I think, that it's a really important one, because people have got to start being a lot more discerning. I mean, I don't know what happened to people online. Like, we all used to know when I was a kid, that you could pretty much trust the Times, but the National Enquirer was probably not where you were going to get the most honest news. So I don't know what's happened, but the explosion of social media has certainly changed that. But I think one of the things that we can say about Cayman is that it's a small jurisdiction, as John said. We as journalists here all know each other pretty well. And you can track us down. If I'm writing a load of old be on my website. You can track me down and hold me over the course for it. So I'm not going to take that risk of running into you in Foster's and you bending my ear, Kevin, because I've said some rubbish about you that weren't true. So we have a certain, and the politicians feel like that about us as well. I mean, everyone, as soon as I write something, if there's a slightest undotted I or uncrossed T, somebody's on the phone to tell me about it. So there is actually in Cayman a really good check and balance on journalists, because you are very close to the politicians, you're close to the news as it's happening. We're not doing this, we're not far away from the source like you might be in other jurisdictions like in the United States. And I think, you can trust us because you can get us, we're easy pickings. So, but it doesn't mean to say that doesn't actually also require us to continue to be honest and decent. You can't, there are times when, I learned very early on in Cayman, you can't always wait for the government to confirm everything, because people used to take the attitude here that if you didn't confirm it, then they won't write about it, and it took them a long time to realize that actually that's not going to happen. We're going to write about it. So we're giving you a couple of days to be decent. But if you haven't got back to us with your confirmation, if I've got other sources, I'm running with it. And now you've missed the opportunity to give us your 2 cents worth. It's still very important that people, our readers, our viewers, and our listeners continue to hold us to account.
John.
Yeah, well, I have to agree with Wendy. We're a small jurisdiction. Everybody knows each other. To put it bluntly, like if you get something wrong, and we're all human, we all make mistakes, but if you like blatantly write something that's incorrect, you will be chased down. You'll get negative comments. You'll get the email. You'll get a phone call. And, I think it's our job to ensure that info that we use is correct. And we have to use the best sources available because, we're providing the public with information. And, if you provide the public with wrong information, it could be a nightmare situation.
April, on to you.
Boy, it's now what is left to say, right? But I think, in all honesty, the accountability component of it, as Wendy touched on, I mean, look, this is my home. This is where I'm from. I grew up here. Sometimes it's not just my reputation on the line, it's my parents' reputation on the line too, right? And my relatives. So the community does hold us accountable here. And sometimes it can be challenging. You pass on a piece of information that you've attributed to a specific source, and it's, all in public domain, but someone on the other side of the story who you happen to know is like, that's completely not true. I trust you to find that the truth of these, that all of that is difficult sometimes, but I think it's really, really important, because I think we all can get lazy, get tired, get apathetic about things, over time. And having, sort of a vibrant listenership, audience, viewership, I think that's part of, just like the press should be keeping politicians honest, I think the public also needs to help keep the press honest too. I think it's a two-way street on that. And by the way, I don't enjoy it when I get it wrong either. It's most humiliating, so I don't like it a bit. So there is also a bit of professional pride as well, that I think, look, I studied journalism. I studied broadcast journalism specifically. And the first class I took was about ethics in journalism. What does this mean? Why do we do this? What's it for? And, that was a long time ago. But I think even today, when I start to go, I just can't be bothered with any of it today. No, you tap back into the part of you that realizes that our job here is to disseminate information and to do the best job that we can. We want to be as fair as possible. We want to be as honest as we can be. It's just the nature of the job.
And Sandra, you host the Cold Hard Truth on Cayman Mall Road. And so what about you? Why should people trust you on your platform?
Because they're going to curse me out if I get it wrong. No, I think the point has been made that people really have a way of holding you accountable at a different level when it is such a small jurisdiction. Everywhere else in the world, media makes mistakes and they do a small retraction and it's like no big deal. People just get on with it. here in this community, becomes a matter of discussion. It makes the news when the news gets it wrong. So it becomes a point of discussion as well. And I think, as everyone has said, it really comes down to your reputation. And, I must admit that we have been in a very interesting position where initially, perhaps we weren't really that concerned about our reputation because we were just trying to, get the information out there. And there were times that we knew that it wasn't 100%, it may not even have been 80%. But as Wendy said, there was this, and we still do it even now, this sort of feeling that you have to put something out there in order to get the officials to respond. And it actually works really, really well from our perspective, because we have found that, once the story goes up, they go, oh, well, this isn't quite right, or that isn't quite right. Now, what I found as a result of that is when we do reach out, we're actually getting a response in a little bit more of a timely fashion. And that's because we've had to push the envelope to say, you know what, the story is going to go out there in some form or another. If you want it to be 100% accurate or reflect your position, especially as it relates to government organizations and entities, then give us a response. And, that, I guess, is a little bit of relationship building. And so, we're slowly getting there. But yeah, it's definitely, no one ever wants to get it wrong, because I feel like people will not let you live it down, and so there's a lot of pressure, as April said, to try to conform to at least accuracy as being the number one rule.
And now that's exactly why I want to pivot on over to the discussion really from tonight, where we want to really discuss the challenges of being able to cover COVID-19, because I know there's been multiple times I have reached out as well. I know all of you have reached out to try to get some information. And like you said, Sandra, that it'll sometimes slow to get confirmed information. It's been incredibly challenging to get some of that information out there as well. And that also leads to some of the public being a little upset, or inaccurate information getting out there. But April,
yes,
you want to kind of pick that up a little bit, and
that's a tough one for me.
I'm sure it is.
So here's the situation. And for those who maybe don't see the nuance here, Radio Cayman is, what's our slogan? We're the voice of the people, right? So we have talk shows, we have newscasts, we are connected to the government, but it's not like the government sits there and goes over the news scripts every day and tells us we can't do things. It's not that way at all. But we do have sort of an extra burden of responsibility, and it's a good burden to have, to say, we really need you to, confirm this, or say something, because we're a government-owned station, for goodness sake. So there is that, and that's a real thing. I'm going to take my journalist hat off for a second, though, and say I do understand, the other side of my brain understands where someone is not willing to put out a statement yet because they haven't had a chance to get all the facts together. And there's this desire to present like the whole, version of everything with all the details, and it should all be correct, and every nuance and word ironed out, and it goes through 16 approvals. I understand that that's one of the challenges that governments in particular struggle with. But the media side of me says, you don't have to say everything right away. You can say something and come back with more later, and clarify and confirm and expand. And so at the risk of getting myself in trouble, which I haven't so far, so good, I think it is one thing that I would encourage actually public officials to do, is to maybe not try to be so perfect about the information, just be a bit speedier sometimes about at least letting the public know that you are working on it, that you're double checking the information. I think perfection sometimes it causes distrust between the people who are supposed to be, giving the information and the general public. And I just think don't worry so much about every graphic being perfect, or, every 17 people approving. Keep it simple, keep it clean, answer the questions quickly. If you say something incorrect, correct it. And I think that actually would build trust for everyone all around on an ongoing basis. And yes, it is challenging for us to know what kind of information to send out there. But as Wendy and now Sandra both know, and John, you too, because you're relatively new to the game. It's very difficult to say to your audience, I can't tell you anything because no one will answer me.
Yeah.
You
Wendy,
know,
want to pick that up as well?
Yeah, I think we're going through a period of time right now when what April was talking about is really, really relevant. We have this situation now with the figures and the what's coming out, what's not coming out. Right now, people really want that information. We know that public health officials who are busy sticking needles in people's arms and swabs at people's noses and answering the phone to people that are like, crying and dealing with a sudden mass sort of catalogue of people with all sorts of issues. We're not asking those people to give us the numbers. Government must have and should have people who collect data. And that data should be getting input into some kind of app or some kind of computer or some kind of database every single day, every single hour, every single minute even. The Premier was able, when he was on Sandra's show the other morning, to look at a WhatsApp or a message he'd got that had the actual figures on for that day of the people that were in hospital. So the figures are there. So there must be somebody that can give them to us. We're not expecting doctors to drop their stethoscopes and come running to tell the press how many people have been admitted to the hospital. But it is really important. The more you don't do it, the more you scaremonger and the more you make things worse. And even if, as April said, your graphics are not great, or you haven't got this bit done, or you haven't got that bit done, they can do that later. But when it comes to the basic figures of what everybody needs to know, they should be on it and they should be giving it to us, because otherwise it creates a volume of a vacuum, of information into which all sorts of horrible conspiracy theories can converge. And
I have a great imagination, Wendy. I have a great imagination. So the longer it takes to, you give me some good information, even if it's just a lot of numbers, I will calm down. But the more time that goes, the more
give me some numbers
I
to
get.
shut me up. Yeah, give me something. We just need to feed the news monster, because that's the way it is. Give us something, and we can put something up later. You can correct things. Right now, people want to know. And for some reason, public health seems to think that we shouldn't be. It's not important that we know how many people are in hospital or how many people tested. It is. Believe me, people want to know. The evidence is there on the discussion groups, on both on our website, on the Facebook pages. It's the only thing that people are talking about. And development, of course, people are still talking about development. Yeah.
And context about that data is important, right? So respectfully, sometimes the bunch of numbers that I may spit out at any given point that I've received, in and of themselves, may not be particularly valuable in that moment, other than I want to know, right? Aside from that. But without the data, you don't ever get to the point where you can provide context on it. So you have to start with the information and then provide context. And so, I appreciate the desire to keep everyone sort of calm and, trying to do the right things. I completely understand the desire to do that. But I also think that this entire, it's something about the way we have begun to consume content. It is so instant and we need it so quickly that you turn that off and you become the bad guy. And that's not what you want, right? Whoever you are disseminating information of this type, it's important that you do it as quickly as you can, as accurately as you can. And maybe you don't give it all at once. Maybe you give everything you can right now, and we'll complain that you didn't give us everything. And in a couple hours, give us the rest of what you've got. I think that will help, in my view.
And I think so, yeah.
Yeah, and I have to agree with both Wendy and April on this, because I think that's kind of how, CMR probably got to where we are in terms of the instantaneous nature of what we do. So, somebody farts in East End, we're going to tell you about it. And so there becomes this expectation that we've, fed into, that people get information right away. Now that we are being a little bit more cautious, sometimes I know about something and I'm in the background trying to verify and get the facts, and people are messaging me, well, why don't you have this up? Because we've kind of created this expectation that you just throw it out there and you just put it up. But, I'll say to them, yep, I'm totally aware of this situation right now, but I'm trying to see what this is all about.
Yeah.
Yeah, I mean, we've got 2 stories today that we have sat on, both involving, minor children, that we actually didn't do anything about because I'm trying to figure out what the story is even. So, especially with COVID, I think there's a requirement to be that much more cautious when you hear these stories, when you've got people. I mean, Kevin can testify to this. For example, we had a child who said, they had developed a particular syndrome as a result of the vaccine. And they said that essentially the doctors at this hospital had told them, at a particular hospital overseas, had told them that. And I had the story all written and ready to go. And I said, hold on a second, I cannot responsibly publish this without speaking to that institution to hear what they really have to say. Because it's one thing to say, oh, somebody told me XYZ. It's another thing to speak to that person and actually confirm, was this actually said to this family? And as it turns out, they couldn't speak specifically to that case, but the story turned into a very different story once we actually spoke to the PR managers who had spoken to the physicians at that facility. But they needed time to be able to trace the patient, because they're like, listen, we've got, do you remember, Kevin, how many physicians they have at that hospital? I think they said like 800 or 1,200 or some ridiculous number.
Right, it was something crazy.
Yeah, physicians at that hospital. And they're like, listen, we don't even know who this person is. You guys live in the Cayman Islands, you just got a few people, one person does something, everybody's like, oh yeah, we know that person. Here in Miami, that's just another person to us. Like, it's not really all that relevant and it doesn't ring a bell. And so, they needed time to kind of even try to figure out what case we were, inquiring about, just to make a broader comment. Again, they wouldn't specifically comment on any particular patient, right? But going back to the whole thing with the COVID figures, I think the danger there is when you don't get, so for example, right now, we all have this delay in getting the numbers of who's vaccinated and who isn't vaccinated. That seems to be a particular interest to people, especially the pro-choice or anti-vaxxers, because they think that information is being withheld on purpose for a reason. And they don't get that, public health is just really overwhelmed and they're really busy. And the way in which that information is actually verified isn't how they think. So it's not a person who walks into the hospital and says, okay, I've done a PCR test, I'm positive, and yes, I'm vaccinated. Like, they can't take their words for it. They actually have to go back to their database and verify that they actually have been vaccinated. And, the average person, I think, on the street doesn't necessarily appreciate the public health protocols that have to be followed and why that information is lagging. And they automatically assume that there's some other conspiracy-based reason why that information isn't available. And it's really frustrating for me because I get the questions every single day. Like, why are they not telling us how many people, like today we found out, in the hospitalization numbers, how many are vaccinated versus anti-vaccinated. Now they want more. They said, well, of the ones on oxygen or the 3 that are in ICU, how many of those are vaccinated? Because the point still could be that maybe they're all vaccinated people and you're trying to hide that from us.
Right. And there's this question of public interest versus public, curiosity, I suppose, or public benefit. Just because I want to know something doesn't mean in every instance that I'm going to get to find that information out instantly. But it is truly significant from a public health perspective and a government perspective to ensure that you are as transparent as possible, particularly where things like data and numbers are concerned. It's essential, I think, for it has a lot to do for me with democracy and how that all works. I think if you appear repressive, people will feel as though you're being repressive. So it's kind of important for us to keep asking. And you know what? Public health, I have a great deal of sympathy for in the circumstances. It's just a wave of information that you're trying to keep up with and verify and put out there. It's tough. But I think what perhaps this pressure will make more happen, get better infrastructure.
It's really important what April just said about public health. They shouldn't have to be dealing with it. Where are the epidemiologists? Where are the people that collect data? Cayman has fallen down in government. We seem to spend huge amounts of money on all sorts of things, but data is really, really important, and we've never really seemed to think it is. And it seems crazy to me that here we are in the depth of an epidemic doing a census, and yet we don't have any way to collect important information on a day-to-day basis. We know so little about so much. And it really does worry me, because as Sandra said earlier, every time there's an absence of data, it is filled with a conspiracy theory.
Yeah, I'd have to agree with you. I'd have to agree with all of you. Public health are obviously inundated with questions from us and questions from everybody, but I really do feel it's important for the government, to get this information out, in a timely manner. Obviously, they need to get the information right, but if the information is delayed, we have people, they resort to fear, and people get scared, and people. It's a very stressful time for people right now, especially with the recent COVID outbreaks. So I think it's really important for information just to be shared.
And just to Wendy's point, I do know that an epidemiologist is coming. They're on the way, but this begs the question as to why at this late stage, they're now just coming. I mean, and this really, I think, demonstrates a little lack of maybe forward thinking that this particular government needed to put so much in place when, there's a little bit of politics here, but this is how politics impacts all of our lives, when in fact, we should have had an epidemiologist on board from the second this was named a pandemic by the World Health Organization over 12 months ago. We should have seen immediately the necessity to have someone who has that level of experience. And I think it's a little bit concerning that the powers that be didn't see that. And I don't know if that falls on the elected officials or if that falls on, the medical health experts, such as the chief medical officer, to have gone to the elected officials to say, what, we need an epidemiologist on board like yesterday, and let's start the recruitment process immediately. I know it's happening and it's coming, and I think the person's supposed to be here by January. But, I appreciate that this is like 2 years into the pandemic.
Yeah, January's a little late, isn't it?
It really is. And to that point, and back to, trying to get data and information, because I know the data's there, because I have had, the communication team tell me, yes, I have it. However, I am waiting for approvals on it, which is completely ridiculous because, again, on one of the previous CMR COVID Spotlight shows, I brought on an expert he analyzed the Cayman Islands data, but he's analyzing the data based on other websites that are out there and other tools that does have the accurate data. However, he needs some more individual data to be able to do a proper analysis to give Cayman a real proper forecast and picture. He's done it for the United States, and this is what he does. He's been doing this for a very, very long time. So I've asked for the data that he needs. I was told, yes, you could go ahead and get the data. It's not public right now, but we will get you the data. And then they said that we have the data, but we're waiting on someone to approve it. I don't know who that someone is who needs to approve it, but I have not yet received it. But based on at least some of the initial data that was presented, it looks like the Cayman Islands is doing exactly what he predicted. And I'm going to go ahead and play that video from that show now, so everyone could kind of just be reminded of what was shared. And just go ahead and have a watch of this, and then we'll get back to the discussion.
Asking when can we predict that the pandemic will fade out? Like I said, 250 models, are what we select and make the forecast about, and this is the variation that you're seeing. Now, because you got 250 models, we can work out the probability of elimination, and the inverse of that is probability of resurgence, right? So that is by looking at how many of the 250 curves go to extinction, 0, and how many will actually recover. So the blue line here is the probability of elimination. And if you look at with the current social measures and vaccination, you'll hit 95% chance of elimination on February 4th, 2022. That's what we are forecasting. The first week of February, you'll have only 5% chance of resurgence. After that, the chance of resurgence will become smaller and smaller, meaning the chance of elimination will increase, so you can become safe. Okay, so before that, right now, if you look at it, we are about 50% maybe chance of elimination. So it's very risky. You need to hit about 90 or 95%. That's when you can say we can fully reopen the economy. So that is the date that we are forecasting with current social measures. If you've released all social measures from today onwards, you will reach that November 4th. That is because the infection will burn through the remaining susceptibles. And I didn't forgot to point out that is about 17% are currently still susceptible. They will burn through susceptibles and then they will decline very quickly. And because of that, you will reach elimination much earlier, November 4th, 2021. But the trade-off is a lot of people are going to get infected. Look at the numbers here. At peak, we're hitting 700 people compared to the current social measures. The peak is like, not peak, some of the curves can go up to about 140 or so. Here, some of the curves can go up to about 700, just above 700. So that is the trade-off.
Just to clarify that, so you're saying that the risk, if we just continue, just to completely open up, of sometime in the not so distant future, having somewhere between 700 to 800 people possibly hospitalized, getting infected, as opposed to if we kind of slowly, methodically open up slow over time, you're looking at somewhere around no more than about 100 to 150 people becoming sick and hospitalized. Or so.
That is at the extreme. Remember, the median is much lower. If you go with the median, this is the median prediction. This black line here, only 30 cases. What I'm showing you is this variance, each of those curves, right?
Got it.
And this median is only 430, but you can go up to 700. Here, the median is 30, but you can go up to 100 over here. See?
If you're planning for doomsday, you're planning for the worst case scenario, but you're looking somewhere in the middle, it's kind of where it will probably fall. Okay.
Yeah, exactly. Yeah. But there are, and the other thing about full release that, maybe we don't appreciate is that full release will allow you to get to acquired immunity faster. Okay, in theory, right? Because a lot of people they get infected and then they recover and become immune. That can occur faster. That's why your chance of elimination is can occur much earlier as well.
And
so
it's always a trade-off. Increasing and overwhelming your hospital system.
Yes, but you will overwhelm your hospitals. So that is a dangerous way of getting herd immunity, in other words. The safer way is through vaccination.
Yeah, so I mean, again, if we had data, we would be able to do better predictions. That show, just for your knowledge too, was about a month ago. So again, things would need to be readjusted, but no data ever came to be able to redo the predictions to see what's going on. But again, you could see, with a couple hundred cases occurring all the time, where we're certainly, seeing that burn through rate, and would really love to be able to forecast how soon is the Cayman Islands going to be out of it. And I'm sure people want to know, they want to be able to make their plans for Christmas and other things that are coming up.
And what's interesting about that, Kevin, is after that show, we had a number of persons reach out to us who said that they had been told, and I don't know who would have told them, I guess on the medical side, that the information that even that epidemiologist was able to put together in a very detailed format was not something that was possible to do for the Cayman Islands. And so, I was like, well, this total stranger could take relatively limited information and be able to extract such detailed information and predictions from it. Even if he's in the 80 percentile in terms of accuracy, that's better than nothing. You know what I mean? And so you need to go back to the drawing board and question the people who are telling you that it cannot be done. And again, I think this is to be fair to the powers that be. A lot of times they are relying on people who are supposed to be experts, but we oftentimes need to look outside of the jurisdiction to speak to people who have the level of experience that is required during the times of a pandemic. Because no one here has ever done anything like this. Media has never covered a pandemic of this magnitude ever. H1N1 might have been around, Wendy in April probably did a little bit of that, but that was nothing like this. So this is a very different game altogether, right? And I think that, no person in the world at the beginning of this pandemic could say that they were COVID expert or coronavirus expert. But now there are people who are living this day in and day out, and they have seen thousands of patients. They've seen, millions of extracts of data, and studied all that information in detail. That's what they do for a living. And I think it's been unfortunate that we haven't tapped into more of those persons. And that's why I think Kevin has done such a fantastic job with the COVID Spotlight series, is because he has had access to a lot of those individuals. I mean, to have nurses who on the front line every single day sit down on a platform and talk to the Caymanian people about what their experiences have been, what it's like to actually be a nurse and answer your questions, an ER nurse, and what it's like to see patients dying at a rate that they've never seen them. I mean, I think that brings it home, because we've been existing in such an incredible bubble. That brings it home and adds an element of reality that we have just not experienced.
That's probably too, in my view, why some of the behaviors that we are exhibiting now, you don't practice riding a bike. And if you didn't ride the bike for very long, you kind of know what to do, but it's not that sort of, intuitive flow, and I go down the road happily and don't fall over. Because we haven't even, in many respects, experienced the reality of any of what went on in the rest of the world, other than what we saw in our phones and on TV. We're adapting. We're sort of trying to figure out how we feel, how we behave, what we do, as though this just happened. So the rest of the world's been going through it.
Absolutely.
We're suddenly going, I thought I understood what needed to be done, but I can't get between my front door and the car without trying to find where the mask went, and did I put any sanitizer, and oh shoot, I just touched 300 things. I should, it's just the practice, So I think we're in a different situation. And I don't always believe that you need to go elsewhere for expertise. I just believe you always should look for the best of the best, both locally and internationally, and take advantage of the resources, the information, the expertise that they have to offer. It can be helpful in so many ways.
Absolutely. Kevin, we do have a few questions.
We sure
to
do.
get our audience involved.
One of them, Wendy, this one is to you, actually. Pressed it and I double tapped it, it looked like. So Nona is asking, how do you feel about having to squeeze a number of questions that you might have into one or two allowable questions? I believe that's referring to the wonderful press briefings where you don't have a lot of ability to ask questions there. Wendy, can you hear us?
Yeah, sorry. You asked me about the press briefing, right?
Right. So the question from one of our viewers is asking, how do you feel about having to squeeze a number of questions that you might have into one or two allowable questions?
Oh, yeah. I mean, that's it is quite difficult, because there are people have so many questions at the moment, because it's, as April said earlier, it's still new for us. We went a whole year when we didn't really have it, and people just needed some reassurance. And the best thing to do that was to answer the questions. I don't know what happened at the last press briefing as to why everybody was shut down, but it didn't look good. It didn't go down well, and we haven't had one since. So none of this is helping. It's quite, as I said earlier, it's just quite simple. We need people who are data experts. I'm sure we have them. I'm sure we could have prepared for this. It didn't need to be that difficult. There's only 71,000 of us at the worst, at the top end. This is not, we're not dealing with a huge nation here. It wouldn't have been difficult to keep on top of it and just keep feeding people the information that they crave until, as April said, we get maybe used to it. I think your scientist guy the other day was really interesting, and I think he's pretty right. This isn't going to last very long for us, because so many people are vaccinated. It's going to come, it's going to hit it, before, I think we're probably going to hit the peak well before Christmas, and well into the new year. It's going to be pretty much going to be over in terms of a lot that we won't have this amount of, we've got some way to go yet. I think an awful lot more people are going to get infected yet, but it's going to come down, and hopefully not too many people will die. But in order to get through this, the government needs to be far more forthcoming and stop allowing the conspiracy theorists theorists to fill that sort of vacuum of silence. And it really, the last press briefing really didn't help any at all.
April, you want to kind of comment on your views on that question as well, too?
I have such mixed feelings about these things, right? So I'm, prior to coming back home to Cayman, I was fairly used to press briefings were pretty structured, and you knew you would have X amount of questions to ask, and I think that's important. Sometimes, though, you can tell that we're still processing information that we've just gotten, and yeah, we're not as concise or as quick or as together, and the press briefings do draw on for a long period of time. I do have to say, though, I think that if there was more frequency of opportunity to have these conversations, then there might be fewer questions. But look, we have Sandra, who will get up in the morning and have people on her show. People come on For the Record, Talk Today. It's not that they're not accessible at all. It is just that when it is focused around this particular subject, you don't want a 5-hour press conference. You do want the media to be a little more succinct and concise, yes. But at the same time, it's really important that clarifications are made and that important questions are answered. So I'm the first one to advocate for just tell me there are only going to be 2 questions, and I will work. And in fact, I'll call all the other media and say, okay, I want to ask about these 2 things. So I'll do these and you guys can do whatever you want. Yep. I don't mind that in the effort to make it more streamlined and more concise, yes. But it's so important that people do feel as though their concerns are being addressed and that their questions are being answered. Yeah. And the press briefing, the new guys and gals are following what the old guys and gals had in place, which was the press briefing was the place to do that. That may change with the new government, and they may decide to do it differently, and that's fine. But it is important to communicate that and plan for that a little bit. And I think that would help with that feeling. Wendy and I don't have to be on YouTube Live asking everybody's questions all the time. We will do stories about the things that we ask about, true, right? Mm-hmm. But we still need to be able to have an opportunity to ask those questions. And sometimes it can be difficult for a politician or a civil servant to show up on every single show and every single thing individually. So the press briefings did provide us an opportunity to do that collaboratively. But if it's going to take 4 hours, okay, I got you. But let me know how many questions I'm going to get, and I'm happy to really work hard to get them sorted out and focused.
And to April's point, I mean, I agree. I don't have an issue with actually being limited, believe it or not. I think just getting advance notice the last time they did it would have been nice. And I understand that wasn't necessarily a government decision, more than the planners in the background saying that the press briefings are going so long that they're actually noticing that people are dropping out. So the very people that you're asking the questions for, which hopefully are the listeners, are not that engaged. Once the Q&A segments start, and I see the numbers, I do watch the live stream numbers, and they drop off significantly after the first couple questions. And I think there was also an element of some media houses asking 7 or 8 questions. And then because that took so much time, other people may not have even gotten a chance to ask any questions or were then limited to 1. So I think a little bit more equity in how the questions are done makes sense to me. If we're going to limit it to 2 or 3, then that's great. There were some media houses who might have more than 1 reporter there, and each reporter felt like they were entitled to ask a question. So I think it's just a little bit of overkill. And honestly, I think that some of the questions are being asked, the detailed questions, are not questions that you need answered answered at a press briefing. That's something that you could email the relevant officials like public health and so on and get those responses to.
But I do need to point out that some of us are broadcast and some of us are print, yes, and some of us are such and such. And so for someone like me, I actually don't care if you see me or not, or hear me or not. I'm not worried about that. I'm worried about, do I have clean audio that I can take and make individual stories, right, so that this information is disseminated over time. And so that is my primary focus. It's can we get everything we can possibly get out of this, and so that in the coming days, people have an opportunity to get small chunks of this information on an as-needed basis.
Yes.
And so we have Rachel making a comment in there. I think it would help if the Cayman Islands government hired a communications expert to manage all streams of media and proactively tackle conspiracy theories with factual videos designed to be passed around on WhatsApp. And the disinfo on that is on social media needs to be tackled at source, daily, clearly, and fast. And to Rachel, there actually is a communication team, and so this is some of the things that I have highlighted to them as well too. And this is kind of what you need to do. That's what I do in the state of Florida. As you all know, I am in the state of Florida. Currently, I work for the Florida Department of Health, and I am that communications expert for the state of Florida in Hillsborough County's Health Department, to do exactly that. And so I offered some of my thoughts, and I really feel that it was not being done, which is exactly why you're watching the CMR COVID Spotlight, because it wasn't being done, and I wanted to make sure that it was starting to be done. So I brought on a lot of the experts that I have access to, experts that I have used to do my job, to bring it to the Cayman Islands, because ultimately I'm from the Cayman Islands. Most of my family are still in the Cayman Islands, and I love each and every one of you in the Cayman Islands. And I want to make sure that I am doing my absolute best to do what I can to help everyone that I love, which is you all.
That's a lot of eyes there, Kevin Watler. So for those of you who don't know, Kevin and I worked together kind of a little long time ago. And Kevin was the guy who first used BlackBerry Messenger to send out news alerts. And Kevin is one of my favorite people, but he also drove me nuts sometimes. I was like, Kevin, I can't give you another phone to continue to text message more people. And Kevin is the one who also had to deal with that difficulty of, is this story okay to go out? We don't know everything. I'm always like, calm down, slow down. And he was like, go, 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 go. And so between us, there was a lot of push and pull, right? Which I think was very, very healthy. But to Kevin's point, he believes very firmly that you need to provide information to people so that they can make informed choices. And retaining the information and waiting to curate it too carefully can sometimes lead to distrust. And also, frankly, we make stuff up. And so, Kevin, I'm with you on this one. The more information that you can provide, the more interesting, intelligent, informed people are about what's going on, the better choices they can make.
Mm-hmm.
Yep.
Yeah,
and I live by, it's all about the right message at the right time from the right person that ultimately saves lives. Because ultimately, what I say is going to reach some people. What April Cummings says is going to reach some people. What Sandy Hill says is going to reach some people. Yeah. What John Fleming says, I mean, we all have a part to play. We all have different people that will listen to us. And so ultimately getting people that information so they can make these informed decisions, the data is so clear. We want people to really, understand it in a way that they can understand it. And again, get that message from the right person so we could ultimately reach as many people as we can.
Absolutely. Yep. And I think that that's important. I mean, we're not all things to all people. So, there's some people who will never listen to CMR, but, they'll listen to Real Cayman News, or, they've been fans of CNS forever. So they're going to listen to CNS. And so I think from a collaborative perspective, that is where collectively the media should see themselves as allies with one another. And trying to get the message out there to as many people as possible. Yes, we all have a uniqueness that we will bring to our individual platforms, and that's good. There are people who love April's style, and there are people who really loves Wendy's wittiness, her English humor. John is relatively young, so he's probably drawing a much younger crowd. As well. And so, I think that that's extremely important, because ultimately, I think we all have the same goal of wanting to get accurate information, especially as it relates to this pandemic, accurate information out there that will educate people and make them feel empowered to make the right decisions about, what they need to do next. So like I see Carol just made the point that, a lot of the Pirates Week events have basically been postponed or completely canceled for this year. And yet people are out there having, Pirates Week parties. And, that just doesn't make any sense. And that goes against all of the public health advice that is actually coming out from the officials. And I think people need to understand the implications of that and the implications of continuing to spread the coronavirus in this community. And as Wendy rightly said, we're going to start having people die. And I don't know if for some people it will take that for them to then start to take it a little bit more seriously. I would hope not, because I think we can prevent that if we were just all a bit more cautious. But sadly, there's some people who just, they think that this isn't going to impact us that severely. And so even if they're positive, they're still going about their lives as though COVID isn't here.
Yeah. Unfortunately, I think, what Sandra said about people dying, and this is why it's important that people understand the data, because although we are doing very well in terms of most people are not sick, there just by numbers, there will be some older people or people with comorbidities and people who have not been vaccinated that will die now. That's just the way it is. And I would not have wanted to be premier when that first Caymanian passes away, but it's going to happen, whether it's this week, next week, or the week after. It's almost certain that it's going to happen. Now, it could be that person is very, very elderly and they would have died in any event, but the fact is they now have COVID, so it will be attributed to that. And so it's very important for people that's why data is so important, so that people understand what our risk was likely to have been. Once we decided to open the borders, in any event, this was going to happen. As it goes, it came earlier. I don't know. I'm not sure I agree with the opposition that it was as a result of cutting the quarantine time necessarily. I genuinely believe that it was probably something completely different, and I think you all know what we all think it was. But the government should have been talking about this kind of thing in the data about what would happen when we opened up. That was the problem, that they didn't. It was constantly saying, I hope no one dies. That was never going to happen. As soon as we made a decision to open up, we had eliminated, and then we decided, well, we can't stay in this bubble forever, so therefore we have to move to opening up. And we knew with the Delta variant that, because these scientists like Kevin had on the show, they've already shown that these things were going to happen. And so that's why it's so crucial that government, keeps the data coming and that it shows that it's ready. And I think, and I don't think it's necessarily the elected government, because why would a bunch of elected people just 6 months ago suddenly become experts? Our own technocrats have had an easy ride and they weren't ready. They were far from ready. And I think, we have people in certain positions that are not qualified to be in those positions.
Yeah.
Mentioning no names, but, there's some very significant senior medical people who should not be in the job that they're in. And it, and I know it, and everybody out there listening knows it.
Yeah. I mean, and even in the past, and we have, starting last year, when I think there was one instance that really sticks in my mind, where there was a comment made about whether a person who's asymptomatic can actually pass the virus on. I don't know if you remember this, Wendy, because I think you actually did a story on this and you questioned this, because the statement was made at a press briefing that no, they can't. And I was reading information from both the World Health Organization, the CDC, and everybody else, like new emerging data. This was early on in the pandemic, but that was saying that yes, asymptomatic people can, transmit the virus onto other people. And here we are in Cayman having like top level medical experts tell us that they can't. And when they came back and apologized and corrected it later on, they said, oh, well, we were reading CDC information that was clearly outdated, I must say. Because I was a bit obsessive about like reading every single coronavirus related article, all the latest data information that was coming out. And I thought to myself, how is it that I knew that? I'm just a lay person. And the medical experts didn't know that. Like that made me very, very uncomfortable in the moment. And I think,
what I was going to say, because it's in what you've just said, is how many times have we heard them say, oh, we're going to learn from everybody else's mistakes?
Yeah.
And they so haven't, because that's the thing, that what you've just said is exactly the type of thing that should have happened. Like, as we've had all of this time to read everything, the CDC has changed its position on all sorts of things lots of times. It was an evolving from the beginning. Nobody's an expert in this. But you know what? We are 2 years down the line. And if people had been reading everything that they should have been reading, and if we'd have had proper qualified people in the position, and we've had plenty of time to know that we needed a proper qualified person to be running the show by the time we got to this stage, you know, and we didn't do that. And these are the things that are kind of irritating, because it's like, now, oh, well, we're going to blame the politicians. So Paul Wayne is going to be the person that has to preside over the first Caymanian death. It's not his fault.
Yeah, exactly.
So I will say this, and probably shouldn't, but I do believe that at times we, especially when we're in positions of authority, that sometimes we can't see the forest for the trees because we are literally in the weeds of the thing. And I've been at the top and bottom of my food chains multiple times in my life so far. And sometimes it is very, very difficult when you're in the middle of the sprint to see the big picture. So you say the things, but you're not necessarily truly seeing the big picture. And I think that's something, I mean, it's a lesson for all of us. I couldn't point the finger at one single person and say, oh my gosh, you know, you should have done all the things. But I do think that we have to learn, not just from the mistakes from other countries, but the mistakes that we make ourselves and improve upon them on an ongoing basis. I think that's critical, not just for the pandemic, but just in general for how we improve the quality of life in this country and how we do things going forward. We should always know that what we did today may have been what we thought was the best effort, but tomorrow we have to strive to do better. That's just how we should be behaving on an ongoing basis for the greater good.
I'm all about making my next mistakes far better than the last mistake I made.
And that makes good sense.
John, I see you wanted to say something.
Yeah. Well, I think that, you know, we have a responsibility to report facts. I've said that now a lot. But, you know, there's a podcast that goes on in this country that promotes conspiracy theories of COVID-related issues. And, you know, I think that if CIG did, you know, they can't stop this particular podcaster from saying what he wants to say. But, you know, the marketing materials, and I think the marketing materials from CIG have been great so far, but I think there's some information that we could be sending to these people who are COVID skeptics, you know, just, you know, effects of COVID, you know, what happens if you get COVID, because we've been living in this bubble for so long now. Obviously, the bubble has burst and, you know, the tables have turned in many ways for COVID. But we were living in a bubble of, oh, I don't have to wear a mask. It doesn't really matter to me. I'm not going to get COVID if I'm, you know, eating at a restaurant or drinking at a bar. So I think now we really need to focus on proper information. And as media houses, I think we play a role in this. You know, we have to report on the facts. And the fact is that, you know, COVID is out there and it's dangerous.
One of the things I've noticed, because I've also done a reach out to a lot of people, hey, I want to hear your stories. And I want to be able to air that. And so the moment they find out, oh no, you mean you don't want to just hear my story behind the scenes, but you will now want to tell people that I have COVID. It's almost like telling someone you have or you're living with HIV. It's like, oh, no, I don't want no one to know that I have COVID.
But isn't that the most important thing? I mean, it becomes not real if there's no human face connected to it, right? And Kevin, you and I know we go a long way back on this. Mm-hmm. People tend to not want to be open and honest about things like their personal health, but telling and sharing those stories is truly critical to making the connection between the theory and the reality. You know, it's one of the most important aspects from my perspective of a journalist's job, and it's very difficult to do that in Cayman sometimes because people, they're more than happy to tell you everything under the sun until you turn a camera on or a microphone on, and then there's a great deal of resistance. And I just think that's unfortunate because those stories can help save other people's lives.
Absolutely. I mean, there's so many things that I've been kind of working on behind the scenes, trying to be able to do exactly that. But again, finding people to be willing to go on the record and to share it. And again, it's a huge challenge, but it's something that we really need people to help us so we could help others. And that's for all of us. Doesn't matter who you go to. Ultimately, we want those stories shared. Everyone's going to have a different experience with COVID. But we want to hear those different experiences. Let people know what's going on. People might ask your questions, whether you're vaccinated or not vaccinated. People just want to kind of get an idea, get that, if you want to call it, anecdotal information, and then start connecting the dots. That's just how human nature is. And so, the more we talk about it amongst ourselves, the more we share the information to our friends, our family, and out publicly, it's just ultimately going to help everyone. So I'm urging everyone. I know a lot of people out there, and I know personally a lot of people in the Cayman Islands that are living and have currently the diagnosis of COVID. And some are unvaccinated, some are vaccinated, but ultimately we really need you all to share your stories. And I know most of you are going to be okay. And I know one person that's in the hospital personally, and I'm wishing them the best. But again, we really need those stories out there.
Yeah, I agree. I mean, it's very difficult, however, though, because, there's so much taboo with COVID at the moment. If I go on the record and I tell people, oh, I had COVID or I have COVID, people will be scared to, for the risk effects, what's happening, with themselves. But I think it would be really good to have some people, in the community discuss their experiences, because there are people who don't believe in COVID, and that might sound crazy for me to say, but, I'm just looking back at footage from the pro-choice protests, and there's people saying fake pandemic, real genocide, but that's because they're not hearing the effects of the disease. So if we could find people, if anyone could find someone who's had COVID to share their experience, it would be really beneficial to the community.
And it was, if you don't mind my adding, I think for me, one of the most powerful stories it came from a roundtable that the Cayman Islands government, CIGTV, organized. And it was really interesting, and it made it hard for me to just completely disconnect from it all, because you hear things day in, day out, and you're just like, I can't hear anymore. I want to be done. And listening to what the doctor and what the doctor's family went through and the experience that they had, it made an impact on me. And I think even not just about saving lives in the pandemic, but also part of what we do as journalists and reporters is we chronicle a moment in time, right? And of what's happening in our lives, about who we are and what our experiences are. And if we can't capture those moments because the human beings who are involved aren't talking or sharing those stories and those experiences, in a strange way, it almost erases the experience from our histories. And so, not that that's the reason anyone but me is going to think it's important, but I do think also sharing the reality. Not everyone's story of living with COVID is going to be that they had the worst thing in the world. For some people, it was mild or insignificant. For others, it was a terrifying experience emotionally. I feel like you don't want to go on without making sure you have captured some of the moments for the future and for the future generations, so that they know what we lived and what we experienced and can learn from us.
Yeah, well, thank you. Well, April, we're going to go ahead and start moving into the closing comments. So any final thoughts before we leave everyone tonight?
No, I mean, I really appreciate you having me on the show. As you know, I've been quite supportive of this COVID spotlight. I really do. And I'm critical of everybody's work all the time, even my own, but I really did appreciate hearing from experts who maybe weren't in the middle of our trenches, but were in their own, reflecting on things here. The data modeling segment was incredible. And not just because I'm a nerd girl, but I really do like having an understanding of both the big picture as well as the micro experience. And I do want people to know that sometimes it is frustrating to hear us journalists and reporters bumble our way through our questions and press briefings, or ask a question that you swear they answered 5 seconds ago. But do remember that that is part of us doing our jobs. We want to make sure we understand what's going on as well, too, so that we can disseminate accurate information going forward. So we are definitely trying. We're not always going to get it right. We're all a little different in how we approach it, but we do care very much about doing the right thing and providing information to the people of the Cayman Islands. Otherwise, to be honest, there are other jobs that would pay a lot more money and be a lot easier.
Absolutely. Well, thank you, April. Wendy, what are your final remarks for the night?
Yeah, I think what April said earlier about telling the stories is important, but I've always been more of a reporter and a journalist than I have like a feature writer, and I think facts and data and in a pandemic are very important because they do paint the picture in a way, and the human interest stories are going to be great, and I've already sort of started collecting a few, and some they're so different, and so some of them are interesting, some of them are funny, some of them are tragic, so these stories are going to be told. But whilst it's going on, I have some major concerns that we've just had the wrong people in the wrong jobs at the wrong time. And it's a real shame because we've also been very lucky. And I think, that's another thing that it's you can't get away from it as being a journalist, that you have to kind of point out that actually, when you compare us to the rest of the world and other places, we've had a right old time here, really, to be honest. And a lot of us enjoyed the period of time when there was no one here. It was, the Cayman without, it's a special time, Cayman without tourists. But over the next few weeks, the information that we seek is going to be critical because we are going to go through a rough ride. I don't think we're there yet. I think we all agree that there's going to be a rough ride ahead for the next month or so, maybe longer. And it's going to be really important that government keeps on top of that and shapes the picture. And I hope they do a better job.
Absolutely. Well, thank you, Wendy, for participating in this discussion.
Thanks for having me on, Kevin. It's great to see you, man. It's been a long time.
It really has.
Don't be a stranger.
No. Well, certainly I will not be a stranger at all. John, what are your final thoughts for tonight?
Well, I just want to thank you for hosting this. Thank Cayman Mile Road. This Real Cayman News started in the middle of the pandemic. It started last December. We're coming to our year anniversary. And I wouldn't be here without the support of Sandy. She gave me so many pointers and tips, and Wendy as well. I've learned a lot from the journalists in Cayman. We have very fine journalists here in Cayman. So it's really been a great experience for me. And I'm learning every day. So thank you so much for hosting this. And it's really great to share all this important information. COVID-19 is so current. This is probably the first time in history in Cayman that we are begging the government for information every single day because, COVID-19, it just changes every single day.
Absolutely. Well, just want to thank everyone who's watching. I mean, we have just about 100 people that are still watching. I will tell you, please look out in the very near future for the latest data. I do see that we just received the latest information. I'll just kind of read off some of the data. It says active cases. Currently, there are 2,661 cases with 15 people hospitalized. Since the last report, that's an increase of 186 cases. 184 of them were in community positives, and then 2 travel positives. In the Sister Islands, they added 2 new cases to their amount. For the numbers of people who received at least 1 dose of vaccine, 81% now, with 78% of those receiving 2 jabs. They're fully vaccinated. But again, look out for those on social media as well as on Cayman Mall Road. We'll have that story up and not so much. But thank you all for watching so much. Next week on Tuesday, which will be when our next CMR COVID Spotlight is, that's going to look at nutrition and COVID-19. Having a very healthier diet is going to be extremely important in order to be able to best protect yourself against COVID. So we have a nutritionist that's going to be coming on the show to discuss how your diet can be, improved. So if you get COVID, or even before you get COVID and even after COVID, how that plays a role. And as well as we know, holiday season's coming up. That cassava cake and all that good Christmas cooking is going to really be happening. We're going to see more and more of that happening. We want to make sure that people are kind of keeping it in mind as you are choosing your meal choices. So again, thank you all very much for watching the CMR COVID Spotlight. And that's it for tonight. Have a great one, everyone.